Hello, welcome to What in the Nursing, where chaos meets calm. Today we are learning about chronic kidney disease, also known as CKD. So, what is this CKD? This is a progressive, irreversible loss of kidney function over months to years, leads to buildup of waste, water, and electrolyte imbalance in the body. And as I've said, it is irreversible. That means it becomes a permanent and long-term issue. CKD is usually divided into different stages, and that is stage 1, 2, 3, 4, and 5. The stages are usually divided in accordance to the glomerular filtration rate. As for stage 1, the GFR is at over 90, stage 2, 60 to 89, stage 3 is divided into two. The first bit is at 45 to 59, the second 30 to 44. Stage 4 is usually 15 to 29, and stage 5, the GFR is usually below 15. And at this point, we get into something known as ESRD, that is the end stage renal disease. CKD manifests itself in the different system of the body. In the central nervous system, CKD leads to lethargy, weakness, altered level of consciousness, confusion, headache, and seizures due to uremia. Cardiovascular system, we have hypertension, edema, palpitations, and heart failure. In the respiratory system, CKD leads to uremic breath, that is, ammonia or fishy smell that comes out from the individual affected. We have dyspnea, and this is usually due to fluid overload or even the pulmonary edema. In the hematologic system, one gets anemia. This is due to decreased erythropoietin. One can get easily bruised, and there is increased risk of bleeding due to decreased number of platelets. The GAT system is also affected by CKD, which leads to nausea and vomiting, loss of appetite, which is known as anorexia, uremic fetor, and that is the ammonia breath or metallic taste, and GI bleeding due to the platelet issues, as I had mentioned, the decreased number of platelets. CKD also affects the skin, that is the integumentary system. One has pruritus, itching due to the uremic toxins, dry and flaky skin, hyperpigmentation, that is the darkening of the skin, especially when one is at the advanced stages of CKD, uremic frosts, and this is usually the late sign whereby there are white crystals on the skin. CKD affects the kidney, leading to decreased urine outputs, proteinuria, and hematuria, meaning the urinary system is also affected. As for the genital system, there is decreased libido and infertility, amenorrhea in ladies, meaning they no longer see their menstrual bleeding. CKD also affects the endocrine system, leading to metabolic acidosis, hyperkalemia, hypercalcemia, hyperphosphatemia, secondary hyperparathyroidism, glucose intolerance or insulin resistance, leading to diabetes mellitus. Causes of CKD. The main causes are hypertension and diabetes mellitus. Due to the increased blood pressure, it leads to rupture of the blood vessels in the kidneys, hence hindering its functioning. As for diabetes mellitus, the increased level of blood glucose leads to something known as nephropathy, that is damage of the kidney system. Other causes of CKD include recurrent infection, such as pyelonephritis at the urinary system. Due to the buildup of bacteria, it tends to climb at the kidneys. The kidneys get affected, little by little leading to CKD. Autoimmune conditions such as lupus, in this the body's own immune system turns against the body parts, including the kidneys. Due to that, it leaves scars at the kidneys that do not heal, and after a while, the condition leads to CKD. We have untreated AKI, that is acute kidney injury. Something that begins as small leads to something big. So the moment the kidneys get affected and become an acute injury, after a while, it leads to the chronic kidney disease. Nursing interventions of CKD are majorly divided into two. That is, the diet modification and fluid management. Diet modification: decrease the intake of sodium, potassium, phosphate, and protein. Fluid management: monitor input and output, monitor weight. Patients with CKD tend to have an increase in weight. Assess the edema, assess the abdominal girth, listen to lung sounds due to pulmonary edema. Other interventions include administering of medication, preventing infections, monitoring of vital signs. Treatment of CKD. Because CKD is permanent, that is irreversible, the treatment occurs in only two ways. We have the dialysis and kidney transplants. As for kidney transplant, that means one gets another kidney, removes the damaged kidney, and replaces it in the body of this individual. As for kidney dialysis, our next video will explain more on it, but it roughly means that one gets something known as a washing machine for the blood, whereby the dialysis tends to remove wastes, the extra fluid, and also balance the electrolytes. And they are majorly in two types, that is the hemodialysis and peritoneal dialysis. Thank you very much for listening. See you in the next video.